Okay, now can you hear me properly? Can you hear me properly? Is my voice clear and audible? Can you hear me properly? Can you listen me? Is my voice clear? Okay, I'm getting reply yes. Is my voice clear? Is it audible? Is it audible? Is my voice clear and audible? Okay, yes. So we are going to start. So I'm getting reply from so many students. Yes. Fine. So oral contraceptive pills we were talking about. These are the birth control pill. There are so many methods of contraception. Okay, let me know what are the methods of contraception. Write down in chat box what are the methods of contraception. Write down in chat box what are the methods of contraception you know. Write down in chat box. Write down in chat box what are the methods of contraception that you know. What are the methods of contraception you know? Write down in chat box what are the methods of contraception. Write down in chat box. What are the methods of contraception? Natural method, yes. Who is replying? Jhanvi is replying oral contraceptive. Apart from oral contraceptive, which are other methods? Which are other methods of contraception that you know? Apart from oral contraception, which are the other methods of contraception? Barrier method, yes. Nidhi has replied barrier method, Kinjal, hormonal contraception. So, yes, apart from this, do you know any permanent method of contraception? Any permanent method of contraception? What is permanent method of contraception? Which is permanent method of contraception? Copper T is not permanent method. Okay, this is another. Yes, IUCD. Yes, nice. So we are going to see this contraception again. So oral pills they contain and progesterone. So these are considered as also birth control pills. Here there are variety of the pills that we have already discussed. So that this apart from contraception, they have also other benefit. They control anemia, they regularize menstrual cycle, they reduce menstrual cramps. So they're prescribed to reduce menstrual cramp and to prevent anemia. But there may be also side effects. So some women expect. There are basically 4 types of the oral contraceptive pill: combined pill, phase pill, progestin only pill, and emergency pill. Combined pill, progestin only pill, phase pill, and emergency pill. So we are going to see one. So this is how this combined pill look like. In each 28-day menstrual cycle, women has to take contraceptive pill for 21 days only. Last 7 days, she doesn't have to take any contraceptive pill. But to avoid forgetfulness, forgetting taking a pill in last 7 days, iron tablet is in oral contraceptive pill. So it is containing these last 7 white pills are containing only iron tablet. And this 21 pills are containing this. Just a second. This 21 pills are containing estrogen and progesterone. One has to start from this Monday, Tuesday, Wednesday. Likewise, to take up to 21 days, and then last 7 days are for iron. So there is dual benefit of iron, that iron will also prevent anemia. So this iron will also prevent anemia. So that is combined pill. Again, it is containing estrogen and progesterone. Okay. So progestin only pill. These pills are phased. These are phased pills. Phased pills are being provided with the hormones that contain variable amount. Here, estrogen is in phased manner to avoid the side effect. To avoid the side effect of the hormone, so different amount of the hormone are taken over 3 weeks. Then progesterone only pill. Progesterone only pill is containing only progesterone. As the name suggests, it is containing only progesterone. These are daily medication that contain only one hormone. To avoid the side effect of phase type of combined pill, particularly estrogen is having many side effects, so it is prescribed to avoid the side effect of this estrogen. Emergency contraceptive. These are considered as the morning after pill because this is being used to provide protection against unprotected sexual intercourse. They have to be taken within 72 hours of the 72 hour of protected sexual intercourse. Types of emergency contraceptive. There are two types. There is increased dose of the combined oral contraceptive if any women take high dose oral contraceptive or high dose of the progesterone. This is serving as emergency contraceptive. But is high dose oral contraceptive as well as high dose progesterone pill. Mifepristone, one drug is there, mifepristone, which is also being used as emergency contraception. So let me ask the question. Okay, how many types of oral contraceptive pill? How many types? Write down the types. How many types of oral contraceptive pills you have learned? We have discussed 4 types of the oral contraceptive pills. Write down the name of these 4 types. 4 types of oral contraceptive pill. Write down the name of types of oral contraceptive pill. I'm waiting for your answers. Write down 4 types of oral contraceptive pills. Still, I think some of the students have not joined. So, write down the message in WhatsApp to join this class. What are the 4 types of oral contraceptive pill that you have learned? It's only recently, just 2 minutes before. Answer quickly. Okay, combined pill, Nidhi is replying, phasic pill, Janvi is replying, emergency, Hasti is replying, Kushbu, combined, phase pill, progestin only, and emergency pill. Yes, very nice answer. So I asked that some of the students have not, and only 20 students are online. So write down the message that this attendance will be sent. This attendance will be sent to your class teacher. Okay, combined phase, progestin only. Okay, so now we are moving further. So how birth control medication work? What is the mechanism of action? Okay, so in pharmacology, as we know that in every drug, each and every drug has mechanism of action. So first mechanism of action is by blocking ovulation, release of egg from the ovary. Okay, so first is at the start, that is blocking of the ovulation, thus preventing pregnancy. Okay, so first is this. Then second mechanism is by altering mucus in the cervix. Cervical mucus becomes thickened. So it is to avoid penetration of the sperm. It is to avoid the penetration of the cervix. So by altering mucus in the cervix, by blocking ovulation, and by changing the endometrium, third is by changing endometrium. As you know, the endometrium is present in uterus. So it changes the endometrium in such a way that it cannot support the fertilization. Even if there is fertilization, it cannot support. So again, I repeat, by blocking ovulation, by altering the mucus in the cervix, and by changing the endometrium that cannot support this, that cannot support the fertilization. One important mechanism of action that is written here. How does it block ovulation? It prevents ovulation by blocking the death surge. You must have heard in menstrual cycle LH, luteinizing hormone, that on 14th day there is LH surge, and as the LH surge occurs, after that there is ovulation. So LH is responsible for ovulation. So first mechanism of action by blocking ovulation. How does it block ovulation? By preventing LH surge. Then second is altering cervical mucus so that sperm cannot penetrate, and by changing the endometrium, so it cannot fertilize the egg. So this is the picture. How does it work? How do oral contraceptive work? Without oral contraceptive, there will be release of the egg into from the ovary. It goes into the fallopian tube. It goes into the endometrium, and if spermatozoa from below, it can fertilize here. Okay, it can fertilize in endometrium. Actually, so this is with oral contraceptive. With oral contraceptive. So here there will be no release of ova and prevent the release of the ovum, so that, and progestin also causes thinning of the endometrium. It makes the cervical mucus thick. Okay, so this is how, by preventing ovulation, by making this endometrium the lining thin, and by altering the cervical mucus, it prevents the pregnancy. So who should not use oral contraceptive pills? Means what are the adverse what are the contraindications of using oral contraceptive pill? So as you know that oral contraceptive pill are having many side effects. So allergy to any component of the product, means allergy to estrogen or allergy to progesterone, that should also not use this oral contraceptive pill. History of blood coagulation disorder, blood disorder, because oral contraceptive pill can cause thrombosis and embolism. So already those patients, those women who have history of this blood clot disorder, they should not take this oral contraceptive pill. History of stroke, is cerebrovascular accident, stroke occurs in brain, so, or history of heart attack. So because this oral contraceptive pill can also lead to stroke or this heart attack, there can also lead to myocardial infarction, there is risk of MI. So oral contraceptive pills, of course they are beneficial for short duration of the time to prevent pregnancy, but their side effects are very dangerous. Severe hypertension, so those who have severe hypertension, because oral contraceptive pill can cause rise in blood pressure. So severe hypertension, it should not be used. Diabetes, that cause blood vessel problem. So poorly controlled diabetes, severe headache such as migraine, breast cancer, liver cancer, all these are the contraindication of using oral contraceptive pill. Contraindication of using oral contraceptive. Again, I repeat: allergy to estrogen or progesterone, fear of blood coagulation disorder, this stroke, heart attack, severe hypertension, diabetes, severe headache, breast cancer, liver cancer, because oral contraceptive can cause breast cancer already. So already those who have breast cancer should not use. Okay, let me answer. Okay, please answer the question that what is the mechanism of action of oral contraceptive pill? Mechanism of action. We have discussed just 5 minutes before what is mechanism of action of oral contraceptive pill. How does oral contraceptive work? If you have understood clearly, you can down. What is mechanism of action? Okay, inhibit. Janvi is replying, inhibit ovulation. Then okay, Kamali is replying, inhibit ovulation. By ovulation, says, then very nice. By blocking ovulation, altering mucus of the cervix. Khushbu is replied. Altering mucus cervix. Hasti is replied. Because the mucus of the cervix, so it entry of the spermatozoa. Okay. How does it prevent ovulation? I would described. How does it prevent ovulation? Anokhi, making endometrium line thin. How does it prevent ovulation? Answer this question. I have told you. How does it prevent ovulation? How does it prevent ovulation? I have explained you. How does it prevent ovulation? Okay, very nice. Asti says by blocking LH hormone, by blocking LH surge, by blocking LH surge. Purva has replied, I think, previous question by mecanotrium lining gene and altering cervical mucus. Okay, luteinizing hormone. So by preventing LH surge, it prevent ovulation. Okay. So we have discussed about contraindication. Then available dosage form. This contain estrogen, progesterone, as you already know, or progesterone alone. These are available in various forms such as pill. Most commonly, it is available in form of the oral contraceptive pills. Okay, these are also available as injections. Injections are to be taken intramuscular injection. Advantage of this injection is that the injection is not to be taken daily. It is available. It is to be taken only once in 3 months. Every 3 months, only one injection. But disadvantage is that whenever we stop injection, the return of fertility may be late as compared to oral contraceptive pill. As you know that this oral as well as injections are having efficacy 99%, 99.99% it prevent pregnancy. There is only 0.01% chance of having pregnancy. Available topical patches, slow release system as vaginal ring, skin implant. Yes, these are implants which are available. Implant be implanted into the women arm. It is to be implanted on the implant. It may be providing more than that also. As well as oral contraceptive infused device. Again, I repeat, it is available in form of the pills, injections, and topical patches, slow release system, implant, and oral contraceptive intrauterine device. Most commonly used is pill. Okay, and second most common is injection. It is the injections are known as Antra injections are available. So you know that it contains majority estrogen and progesterone. But which estrogen and which progesterone? Some of the name you should remember. Ethinyl estradiol. One name you can remember here. Ethinyl estradiol is estrogen. Some important progesterone. See, if you read the label of the oral contraceptive pill, there may not be written estrogen and progesterone. There is written ethinyl estradiol. Or in case of the progesterone, norethindrone, norethindrone acetate, norgestimate, desogestrel. These are the commonly available preparation of the progesterone. So these are the preparations of estrogen and progesterone. So main purpose, main use of oral contraceptive pill is to prevent pregnancy, birth control pill. So apart from the oral contraceptive pill, or apart from having advantage of preventing pregnancy, it can also regularize menstrual cycle. So in women complaining of the irregular menstrual cycle, they can be prescribed for 3 months. In 3 months, it will regularize menstrual cycle. This is the another use. Even women do not want to prevent pregnancy. In case of the unmarried female also, if there is irregular menstrual cycle, it can regulate this menstrual cycle. Then another use is endometriosis. Endometriosis is that endometrium normally is present in uterus. So what does endometriosis mean? Endometriosis is presence of endometrium at abnormal place. Presence of endometrium at abnormal place. Suppose it is present in the ovary, it is present in the fallopian tube, or even if it is present on the abdomen. So abnormal presentation of this endometrium. Other word, apart from uterus, endometrium is present on another side. It is known as endometriosis. Its treatment or contraceptive pills, estrogen progestins are used. Then polycystic ovarian syndrome, PCOD, dysfunctional uterine bleeding, painful uterine bleeding. It can also treat painful uterine bleeding. So again, I repeat, the use of oral contraceptive pill, pregnancy, regularization of the menstrual cycle, endometriosis, PCOD, polycystic ovarian disease, and dysfunctional uterine bleeding. Okay, let's revise. What are the contraindication of using oral contraceptive pill? In which women you cannot use oral contraceptive pill? Write down the answer. In which women you cannot use oral contraceptive pill? What are the contraindication of using oral contraceptive pills? We have just discussed 5 minutes before. What are the contraindication of using oral contraceptive pill? What are contraindications of using oral contraceptive pill? Write down in chat box. We have discussed just 5 minutes before contraindication of using oral contraceptive pill. Okay, Nikita, liver disease, migraine, asti, severe hypertension, Kushbu, then Shruti, skin implant, Ruchi, hypertension, Nikita, migraine, Kamali, diabetes, hypertension, Janvi, okay, then stroke, heart attack, okay, Princey, heart attack, Nidhi, Kamali, diabetes, Purva, poorly controlled diabetes, Genal, migraine, blood clot disorder, stroke, hypertension, liver disease, Kusku stroke, Asti, poorly controlled diabetes. Okay, let me ask another question. What are other uses of oral contraceptive pill? Just we have discussed. What are other uses of oral contraceptive pill? What are other uses of oral contraceptive pills? Nancy, history of blood clot disorder. You're answering previous question, yes. Other uses of oral contraceptive pills. Yes, Shruti, lower the pain in menstruation. Yes. So, painful uterine bleeding. So, control hormone, irregular menstrual cycle, puja, and Nehur, control hormones. Okay, control hormone. That type of is not there. It regularize the menstrual cycle. So, when you are replying, regulation of the menstrual cycle, endometriosis, very nice. PCOD, yes, very nice. Okay, we are moving further. So we have discussed about use of. So now how to use? Take this medication with food or immediately after meal. Immediately after meal to prevent stomach upset. So yes, you know that in pharmacology, most of drugs, most of medicine, it has been advised that to take after meal to prevent any abdominal upset. So this medication should be taken at the same time on each day, right? So to maintain the normal level of the hormone in the blood, so it is to be taken same time, and it also help to remember. If you take the same time, it will also help to remember to take this, because as you know that this is to be taken daily for years, up to which the couple want to prevent pregnancy. So to avoid any forgetfulness. Now there are two things, that if women forget to take one pill on one day, then she should use two pills on second day. But if woman forget to take pills for two consecutive days, for 2 days, then she has to stop oral contraceptive for that cycle, and she has to switch over to another method, barrier method, using condom temporarily for that period of the cycle. And from next menstrual cycle, it is again she can start. So remember, there's this oral contraceptive pills are to be started on 5th day of menstrual cycle. Fifth day when the bleeding suppress. So again, I repeat that if woman forget oral contraceptive pill for one day, she can take two pills on second day. But if she forget for 2 days, then she has to stop for that cycle and use another method of preventing pregnancy, that is barrier method, that is most commonly condom. So and from next cycle, she can start again oral contraceptive pill. So for the scheme carefully use, hormone containing contraceptive pill, these are biphasic. Again, monophasic, biphasic pill, triphasic pill, 91-day cycle. We are using generally monophasic and biphasic pill. Okay. So mechanism of action already I have told. Again, you can read over here that it prevent LH, FSH and LH secretion. Most commonly, this LH secretion. LH secretion is important to inhibit ovulation. It also thicken the cervical mucus and prevent entry of spermatozoa. There is effect on the uterine tube and endometrium that decrease the likelihood of the fertilization and implantation. Already we have discussed previously. Common adverse effect, weight gain. So most common, this is very most common after using oral contraceptive pill for some duration of the time. You may have seen that after marriage some women gain weight. So because that may be because of this oral contraceptive. Anabolic effect, okay, mild nausea, flushing, dizziness, depression, skin changes. Apart from this adverse effect, it can raise the blood pressure, it can aggravate the migraine. There is thrombosis, embolism. So these are common adverse effects. It can also lead to breast cancer, liver disease. So because of this, it is contraindicated in such cases. So we have already discussed about that. Okay, let me start. So thyroxine. Let me start about thyroxine also. This was very short topic. So we are going to start about on thyroxine also. Okay. Let me check. I'm going to say you that. I'm going to share you the PowerPoint of this thyroxine. Why it is not being shared? Why it is not being shared? Just a second. Again, I'm trying. Okay, I think now you are able to see. You will be soon able to see it has been shared. Okay, now you are able to see. No. Thyroxine, it is not being shared. Why? Let me give me 2 minutes. 2 minutes only. Just give me 2 minutes. Okay, somehow it is not being shared. Okay, I'm going to discuss orally. Later on, I will say this also because we are going to take this again also. So we will discuss for 10 minutes about thyroxine and antithyroid drugs. So just listen to the content. So thyroid gland, as you know, that is present in the over the neck, and it contains hormone like thyroxine, that is T4, then triiodothyronine, that is T3, and calcitonin. So T4 and T3, these are the main hormone. Mainly among them, thyroxine is there, and calcitonin is produced. Calcitonin is produced by which regulate the calcium mechanism. So there, in physiology, you have heard about synthesis of the thyroid hormone. There are steps: iodine uptake, oxidation and iodination, coupling, storage and release, and peripheral conversion of T4 to T3. So this is what you have learned in physiology. In pharmacology, synthesis of hormone is not important. This hormone is regulated by hypothalamus, and hypothalamus produce thyroxine releasing hormone. And this thyroxine hormone acts on TSH, thyrotropin, and it can regulate the physiological system. Okay, so they have action on growth and development. They have action on metabolism, like lipid metabolism, carbohydrate metabolism. It can also it has action on CBS, nervous system, GIT. So many actions are there. So we are going to discuss this next time. I was just briefing upon this thyroxine. So we are going to discuss this next time. And one more thing, today I will be giving you MCQ on previous topic, that is on corticosteroid. And even if this oral contraceptive lecture on the oral contraceptive is being uploaded by that time over on the YouTube, because it is live now and it will take some time. YouTube will take some time to process it, and even if it is uploaded, the questions will come from that part also. So it will not be a test; it will be in form of assignment. So try to attempt it and try to give the correct answer. If you don't know the correct answer, go to the lecture again, read in the textbook again, and give the correct answer. Okay. So thank you very much. We will be meeting next time. Thank you.